Good evening, everyone. So, another efforts from Team Vardaan. I am Dr. Nishi Gupta, one of the team members of Vardaan, and it is our endeavor to help your baby in the preconception and pregnancy and 2 years of infancy to grow holistically. So, today I have come to you with the knowledge on vaccination or immunization in preconception and pregnancy. Hello, Iti. Nice to see you here. Hello, Neetu ji. So today I'm going to talk on vaccination or immunization in preconception and pregnancy. And this part is very, very important to have a, uh good, yeah, hello, Iti. Uh, Good, immunization for yourself and for your baby. So, the preconception, why vaccination is important is because when you take a particular vaccine, it helps you develop antibodies against that particular infection. And whenever you come across that infection, actually, you already have antibodies in your body. And because there is a transplacental transfer of these antibodies to your baby, so it helps you in providing immunity to your baby as well. Sorry. So that is the reason that immunization or vaccination in pregnancy is very, very important. So the vaccination that is needed in the preconception is any area which has a particular endemic problem, endemic disease. That vaccination has to be done before the conception by the mother who is intending to become pregnant. So we always at Vardhan emphasize on undertaking a planned pregnancy because when you have actually planned your pregnancy well, immunization becomes a very important part of that planning. So any disease which is endemic in a particular area, you have to be vaccinated against that particular disease. And in otherwise also it is if you must go for your rubella testing, the IgG and IgM antibodies, and if it is negative, then you must receive the MMR vaccine. And the important point is that you have to be, you should not be planning, you have to be on contraception, or you should not be planning for another 28 days before, after you've received the MMR vaccine. So, similar is the case with hepatitis B vaccine. First, if you're not immunized before, you go for the hepatitis B vaccine and then you must plan pregnancy. Coming to the pregnancy time, during the pregnancy, certain vaccines are a must, which is recommendation by the societies, the obstetric and gynae societies. So on in these vaccines, the most important is the tetanus vaccine. So tetanus vaccine has to be taken, but earlier there was a proposal to take only tetanus toxoid, but now this is almost obsolete. Now the vaccine that has to be given is the TD, that is tetanus and diphtheria, because the diphtheria antibodies that develop during the pregnancy in the mother, these antibodies will transfer to your baby, and because after birth the baby receives diphtheria vaccine at the age of 1.5 months, so these antibodies will protect your baby against diphtheria. So the first dose, that is TD, that is tetanus and diphtheria, has to be taken around the say 17th or 18th week. So that is around in the fifth month of pregnancy. And so please make sure that you are not required to receive only the tetanus toxoid. The first vaccine that has to be given to you when you become pregnant is the TD vaccine, which is the combination of tetanus and diphtheria. The second dose, that is recommended after a month, but now it is not a very clear-cut recommendation that it has to be taken after a month only, but generally it is 1 to 1.5 months. And the second dose that is given is Tdap. So Tdap is a combination of tetanus, diphtheria, and pertussis. So here pertussis is added on, and so again, because DPT, that is the diphtheria, pertussis, and tetanus toxoid tetanus, that is given to the baby at 1.5 months of gestation. So for the 1.5 months, the baby receives protection against these three conditions by the antibodies that are formed in the mother by receiving the tetanus toxoid, diphtheria, and pertussis vaccine. So Tdap is to be given in every pregnancy over, even if the pregnancy has happened within a year of the first delivery, then also Tdap has to be given in every pregnancy. So please insist that the first dose is TD, that is tetanus and diphtheria, and the second dose is always Tdap, that is tetanus, diphtheria, and pertussis. So these are two essential vaccines that have to be given during pregnancy. Now coming to the influenza vaccine, the recommendation is again like influenza is to be taken universally by all pregnant mothers. So earlier it used to be like may or may not be given, but now it is a recommendation because and again influenza vaccine because the strains keep changing every year. So every year it has to be given. For example, if pregnancy is again happened within less in a year's time, then the second dose of or the strain that is prevalent at that point of time, that influenza vaccine has to be taken by the mother. Now coming to the other vaccines, normally the live vaccines are avoided during pregnancy because they can be a little harmful. But there are certain, those, uh, what do I say, that exceptions to the rule that in case the mother is exposed to certain diseases, or if the mother is planning to travel to endemic areas where these diseases are prevalent, then there is a just give you the list of these vaccines which can be given to the pregnant mother when the mother may be exposed to these diseases. So just give me a moment. So these, yeah, for special circumstances, these are the pneumococcal vaccination, Haemophilus influenza vaccination, meningococcal vaccination, hepatitis B, hepatitis A, yellow fever, poliovirus, typhoid, rabies, and if a mother gets exposed to a particular disease, for the vaccinations that I mentioned before, these are if the mother is may get exposed. So beforehand, only before the exposure, we give the mother these vaccines. But if the mother is actually exposed to certain conditions, for example, smallpox or anthrax, then these vaccines can be given. So, if I would talk about rabies, so rabies vaccination has to be given if the mother gets bitten by a dog or maybe some animal where rabies vaccine is required after that. So, the mother will receive the rabies vaccine in the same schedule as a non-pregnant condition. So, these are the important aspects in the preconception and pregnancy. A little bit about the post-delivery vaccination. If the mother had not received rubella vaccine or MMR vaccine before she had conceived, and we get to know that her antibodies are negative for rubella, after delivery, the mother can receive MMR vaccine so that it gives protection against rubella in subsequent pregnancies. So yes, Neetuji, thank you so much for reminding me about HPV vaccine. I was coming to that actually because HPV is a very, very important vaccine and it has to be taken by the women in the age of 9 to 45 years. So if somebody has not taken the vaccine, it is preferable to take it pre-conception. Better to take it pre-conception, but if that time it has been missed, then the best time is to take it in the lactation period. Soon after lactation, soon after delivery, you can take the HPV vaccine, which gives you protection against cancer cervix and viral warts. So, because it is a course of three vaccines, and 0, 2, and 6 months. So first vaccine to be given at 0, the next at 2 months, and next at 6 months, because you know that in the next 6 months you're not going to get pregnant again, hopefully. So lactation is the best time to take the vaccine, because as it is, you're going to go to your doctor for the medical visits. So it can be clubbed with those medical visits, that it's very important to, because cancer cervix is the only cancer against which vaccination is available. So make sure to receive this vaccine in the lactation if it has been missed beforehand. So I think that is all about the vaccination in the preconception, pregnancy, and in the lactation. So if anybody wants to ask any question, you're most welcome, because a lot of people are confused about which month to take the vaccine, which vaccine has to be, I mean, which can be avoided, which has to be avoided during pregnancy, and mainly about the flu vaccine, because this has come up as a recent recommendation. So people are not very aware of influenza vaccine being as a strong recommendation, because swine flu is rampant, and it also gives yeah, yes, Neetuji, definitely prevention is better than cure, and it's always good to prevent yourself with the help of vaccines, and also prevent your baby. Because if you contract any disease because you're so closely associated with the baby, it is possible that the baby might also get exposed to that disease. So you have to really be strong and very well immunized before you go ahead with the pregnancy, and also during pregnancy, whatever recommendation is made has to be followed. So if anybody has any questions, you are most welcome, or else we can end this session.